What's going on YouTube? Drew Nelson here again. This time sort of doing a dip review. Well, not really a dip review, but I'm just going to put a dip in as I talk to you about some of the things that people have inboxed me about as of late, mainly concerned with dental care, like taking care of your mouth, taking care of your teeth, all that good stuff, and still being able to enjoy dip. So let's go ahead and get started on that. Step one, throwing a dip. Today I'm dipping Copenhagen Southern Blend. I just got done with a magnificent morning workout, and it's about 50 degrees and sunny in South Carolina, so I'm just enjoying the beautiful weather, and I figured, hey, what better way to celebrate than with a can of Southern Blend. So let's go ahead and throw one in. First thing that I did want to talk to you guys about, and it's just something that a lot of people have inboxed me about, and that is mainly just oral health in general. How do you take care of your teeth while you dip? I know that I went over something like this in one of my earliest videos, but it was more like tips on diet and exercise, and just eating healthy, all that kind of stuff. So I actually wanted to go more into how do you actually take care of your mouth when you dip. First things first, I'm not like, I hope YouTube doesn't take this the fucking wrong way or anything. I'm not advertising for Crest right now. I just really like Crest, and that's the shit that I picked up at Walgreens when I was drunk as fuck one night. I walked into Walgreens and I was hammered, and I was just like, yeah, I need some whitening mouthwash. And yeah, I actually talked like that. It was fucking retarded. But anyways, the first thing that I would recommend if you are a dipper and you do want to take care of your teeth, because after all, taking care of your teeth and taking care of your oral tissue are two different things, but you can avoid some of the negative effects of dipping, like leukoplakia. Like, it's such a scary word, leukoplakia, but we'll go into why it really isn't as harmful as dental professionals would like you to think. The first thing that I would recommend, number one, for keeping your teeth nice and white, like mine, Crest 3D White. As you can see, I've gone through like half this fucking tube already. This stuff is really great, actually. I never even knew about it, and I thought about trying whitening strips, and then I realized that I wasn't gay, and I was just like, oh well, what do I do? So I went and I picked up some 3D White, and this stuff actually works very well. It just whitens your teeth. Like, I don't know, there's nothing really too special about it. It just whitens your teeth and lets you have a nice pearly fucking smile while you throw fat lippers in. The second thing that I was going to recommend, same line of stuff, Crest 3D White, and this is a mouthwash. This stuff actually works wonderfully. I think even if you didn't have the toothpaste and you just wanted to go get the mouthwash, just the mouthwash alone would probably work wonderfully. I always do, and here's like the main thing that people have asked me about. How do you take care of your teeth? What's like the regimen that you should have? Well, obviously, fucking, brush twice daily and floss. Like, it's not that hard. Your dentist is right. Your dentist does know what the fuck he or she is talking about. My regimen that I would normally do, like, in the morning, assuming that I have time and, like, I'm not late to class or anything, wake up, first of all, then brush your teeth. First, before you brush your teeth, mouthwash with this. I'm not sure if it's a pre-brush or if it's a post-brush rinse, but I always just use it before I brush. So use that, and then brush with this stuff, and then afterwards rinse with this again, and then I like to floss if I have time, or just kind of wash out with water or something like that. The one thing that I did want to talk about is, after you take a dip out, after this video, I'll get done with my dip, right, and I'll throw it in this fucking water bottle because I left my mud jug at home. Take out your dip, put it in the water bottle. I know it seems like a fucking pussy move, but just go to like a water fountain or a sink or something and wash your mouth out with water. I promise it may not like feel like it's doing a whole lot, but it is. It's just getting like extra fucking shit out of there that you just don't want in there. And we can go into more like why, in some of my earlier videos, I do go into like how chewing tobacco and dip in general like causes cancer, but we'll save that for another time. The other thing that I did want to do is debunk some of the dental myths that surround dip in general. The one that everybody has probably heard of and that you've probably heard of is leukoplakia. And leukoplakia sounds like a fucking scary word because it sounds like leukemia, at least to me, which is what Manti Te'o's fake girlfriend, I guess, supposedly died from. And oh my god, I've been following that so closely, and I've been laughing so hard because there was a girl or a fucking person like back home in my hometown, and not to digress here, but this is a fucking important story, so hang with me. There was a girl that from my hometown in Denver that seriously like did the exact same thing and like took some girl's pictures, and she was just this like supposedly her name was Alexa May Baker, and she was like just hot as fuck and added everybody on Facebook. She was like an angel. She was so hot. So like naturally I started spitting to her and was like, hey, like, what's going on? Like, you want to chill out sometime? Like, whatever. And we scheduled to like meet up somewhere, and then I realized I asked her to Skype. She said she couldn't Skype, and I was just like, okay, like, whatever. And I totally realized that I'd never seen this girl before in my life. She supposedly went to, like, or she had, like, just moved to our hometown, but, like, nobody had seen her around town, so it was, like, just sketchy. I thought I was gonna, like, go to this meeting place, and there was just gonna be a fucking white van there, and I was gonna die. But she pretty much did the exact same thing that Manti Te'o's fake girlfriend did. Not to me, but just to, like, because I called that shit off. I was just like, oh, my fucking Chris Hansen senses are tingling right now, and this is just a bad fucking deal. But it was sketchy. It was really sketchy. But anyways, leukoplakia. Leukoplakia is pretty much when you get these sores in your mouth. For those of you, most of you probably already know, but it's just sores in your mouth that are accumulated cells. That they're just accumulated skin cells. So it sounds like a scary word. Really isn't that bad. The only thing that you really have to watch out for, that you don't really have to watch out for, but you just want to make sure with leukoplakia, is that they don't turn into oral lesions. And oral lesions are kind of like leukoplakia, scabs or whatever that bleed. And as long as people have talked to me, inboxed me, asking me questions about receding gums or, getting sores in your mouth or anything like that. And bottom line is, I mean, you could check out Mudjug 1's video on this. And I mean, he puts it perfectly well. You guys, if you're gonna dip for a while, you are going to get sores. It's just natural. The same thing would happen if you put a lollipop in your lip for an extended period of time. Just having something in your mouth that your oral tissue isn't accustomed to it's gonna cause sores. You're gonna get canker sores like underneath your tongue and shit, and like in your lip, all that. It's really normal. It's nothing to be concerned about. You're not getting cancer as long as you just go to the dentist, and your dentist will check you out, and if he sees cancer, then he'll diagnose it right there, and they'll be able to get that shit out. So dental checkups every 6 months or so are definite. Like you probably should do that. Granted, you could probably like diagnose it yourself, but I would also just trust a dental professional's opinion over mine. So the other thing, and I started noticing this, and I got a little paranoid too at first, because it had just never happened to me before. Sometimes when you throw a dip in, your jaw, like this nerve like that runs kind of along here, will start fucking pulsating and shit. And it's like, it's a scary feeling because you feel like something's like bubbling up inside your jaw. And from what I've researched and from what I've read, it's really nothing to be concerned about. As I said before, the main thing that you just want to look out for is if your gums are bleeding after you take a dip out, and like you take a dip out and then you like spit into a bottle or whatever. If there's blood in that and your gums are bleeding, it's probably time to up your oral hygiene. Really brush, really floss. Flossing is probably one of the most important things you can do, mainly because it strengthens your gum tissue. And it gets plaque out from in between your teeth and shit. So that's kind of brings me to my final point, I guess. Um, all of this, these symptoms, these canker sores, these, the pulsating jaw, all that kind of stuff, in my experience, it's only happened to me with long cut dips like Southern Blend. So, as much as everybody likes to rip on them or whatever, don't be afraid of taking a break, every 1 or 2 weeks and just chewing pouches. Um, for me, that's kind of the reason that sometimes I chew pouches, and the only reason is that it gives your gums a break. It gives your oral tissue a chance to repair itself. So people might make fun of you, like, fuck it, whatever. Like, at least you're taking care of your mouth. So don't be afraid of pouches. So we went over the health or the mouth care regimen. Some of the myths, not myths, but just stuff that you really don't need to be concerned about. Leukoplakia, sores, aches, pulsating. As long as you are taking care of your mouth and you are, brushing very well, you're flossing very well, there really is nothing that you should be too concerned about. But at the same time, I would recommend that you do see a dental professional, a hygienist, every 6 months. Get your teeth cleaned, get them to check stuff out, because you never know if there's like some shit like back in here, like whatever, that you can't see or you can't feel. So I think that about wraps it up. The other product that I was going to recommend, and it's actually like, if you can't afford, like, this was like $5-6 or something like that, which is a lot for fucking mouthwash. But if you don't want to, invest, or you're weary about chemicals and shit in this, the other thing that you can do is hydrogen peroxide. Hydrogen peroxide is a really good, number one, antiseptic. Number two, it's a good oral debriding agent, and debriding pretty much means that it just takes extra shit off of your teeth. So it's going to really clean stuff out. Also, it provides a lot of, let's see, what the fuck was I reading about it? It's not oxygenation. What the fuck is it? It might just be the whole antiseptic factor of hydrogen peroxide. Hydrogen peroxide is a really good dental thing to do. It's okay to like to use hydrogen peroxide as sort of a mouthwash. That's what I did for a little while, and then I realized that I was like swigging hydrogen peroxide and using it as a mouthwash straight out of the bottle. You can do that. The taste that you get is like very fucking metallic, and it's not very pleasant at all. So the one thing that you can do is just dilute it with a little bit of water and use that as a mouthwash, or soak your toothbrush in it overnight so it'll disinfect anything that's on your toothbrush, and it'll get some hydrogen peroxide on your toothbrush for when you brush your teeth. So top 3 things that I would do if you're concerned about sores or leukoplakia or any other oral symptoms that you might have because you've been dipping for a while, or if you're just starting dipping and you're getting paranoid about some of the fucking canker sores that you're getting or anything like that. Number 1, floss. That's probably the most important thing, is just floss. Floss 2 to 3 times a day. Like, after I take out a dip, I usually go and wash out with water, and then I floss, just because it gets shit out from in between your teeth and all that good stuff. Then invest in some whitening products, some whitening mouthwash, some whitening toothpaste, and your teeth will be looking fucking prime. And the third is just visit a dental professional, just because, as I said before, you never really know. And that kind of goes back to why dip is safer for you than a lot of things. If you think about how easy it is to diagnose and detect oral cancer, as opposed to like fucking lung cancer from smoking or anything like that, oral cancer is one of the easiest cancers in the world to detect, and that's why the survival, the expectancy survival rate of people with oral cancer is obscenely high. It's just ridiculous. The only way that you will die from oral cancer or anything is if you're a dipshit and you don't take care of your teeth, you don't have a healthy diet, you don't all you do is sit around, you take dips all day, and you drink Diet Coke, and then you're fucked. But as long as you got a healthy diet, you take care of your mouth, you'll be good to go. So thank you guys for watching. I will be coming back shortly with a review on Levi Garrett. because I have been wanting to review some of the like leaf tobacco dips, or dips, fucking chaws rather. So I will be coming back with a review on Levi Garrett shortly, and I don't know, probably some more ranting about Manti Te'o, just because that shit is really fucking entertaining to me. So thank you guys for watching, and keep on dipping, and I appreciate it. Thank you guys.